Welcome to eHealth Radio. I'm Linda DeWitt. Do you ever feel anxious or depressed? Do you want answers to help you understand these feelings? Joining me is Kimble Richardson, a licensed mental health counselor at Community Health Network. Kimble, probably everyone can claim one or both of those feelings and do at some point. Let's start with anxiety, so I'll break these apart. How do the behavioral health experts define anxiety?
Anxiety is an emotion that has attached to it a sense of fear or dread. And I want to point out that this is a very normal and healthy emotion and feeling that people have. It's just when it can get too much or too overwhelming that it becomes a problem.
It would affect your daily life, and then there's a bigger problem.
That's right. If it affects your ability to work or to have relationships with other people, that can be a problem.
Is anxiety genetic or hereditary? And are there environmental risks involved as well?
Mm-hmm. It can be. It's one of anxiety and depression are two of the behavioral health diagnoses that can be inherited. It doesn't mean if your parents had a problem with anxiety that you will, but you're more likely to. And it's also something that can be observed. You can become anxious because you observe your parents or your caregivers anxious in some aspect, interestingly enough.
That is interesting. Mm-hmm. When does it become a problem in your daily life? And when should a person realize that it's bigger and seek professional help?
Well, I think when it becomes, when it infiltrates, I'll use it because it can be a bit insidious. It can kind of creep up on you, if you will. If it affects your ability to concentrate and function at work, if it affects your ability to go out in public or to initiate or maintain friendships or romantic relationships, I think that's a problem. And it would be for most people, I would suspect.
Are there several, or a few anyway, disorders that fall under that whole umbrella of anxiety? Mm-hmm. So maybe some different disorders there. Could you name some of those?
Sure. A phobia is under an anxiety disorder. Social phobia or fear of being in relationships or around in front of other people. Panic attacks are part of anxiety. What we call generalized anxiety disorder, also post-traumatic stress disorder, obsessive-compulsive disorder, and acute stress disorder are all in the category of anxiety disorders.
Now, can panic attacks be normal? You hear about a lot of people that have those. It seems like it's more common than what we might think.
Well, I want to qualify the question normal. Many, many normal people have panic attacks, but panic attacks in and of themselves are a sign that something's not right, and they can be managed, typically with a combination of talk therapy and medication, or just talk therapy by itself.
And that was my next question. So I want to talk about some of the treatments for anxiety. Obviously, there are different disorders,
right,
and probably one prescription fits all does not apply.
Correct.
So typical treatments would be for some of them.
I would say medication alone, talk therapy alone, or a combination of thereof. And lots of research has shown, especially with anxiety disorders, that talk therapy simply by itself can be very effective, particular kinds of it.
Moving on now to depression. What are the typical symptoms of a person experiencing normal signs of depression?
Mm-hmm. Well, you would think that most people would know this, but surprisingly they don't. But generally feelings of sadness or loneliness. But for some people it's more agitation and anger. So you kind of have to really do lots of questioning for some folks to get at what it really is.
And then what can be done to ease those symptoms?
Well, trying to find out if it's what we call endogenous depression, which means it's biologically related or caused, or exogenous, which is the fancy word that means something in somebody's life, caused this to happen.
A major life event.
A major life event or a series of life events, right.
So what is the fine line then between depression that most would consider a normal human emotion, and then clinical depression? Where do you draw the line there?
Well, it's very specific as it relates to the Diagnostic and Statistical Manual, which is the manual that most mental health practitioners use to make a diagnosis. And you have to have certain criteria within a certain time period. But when you hear the phrase clinical depression, that's another, generally speaking, that's another way of saying major depressive disorder, which is a diagnostic category.
And then the treatments available for those people?
Very similar to anxiety. Generally, it's a combination of psychotherapy or what we call talk therapy and medication, or it could be just one of either one. Of course, I'm a big proponent of psychotherapy. That's my area of expertise, but certainly medication is indicated and needed for many people.
Lastly, what is the best way for someone trying to get a loved one or a friend or themselves to seek professional help?
This can be this has to be done with genuineness and honesty. And what I normally recommend for people is just telling their friends or their loved ones, I care about you and I'm worried about you. Here's what I'm seeing, and just list very specifically, you know, I notice that you're not calling me back. I notice that you're in a bad mood. You seem to be crying uncontrollably sometimes, or, you know, you listed out what you're seeing and saying, I think that this is a problem, and would you please get some professional help for it?
Kimble Richardson is a licensed mental health counselor at Community Health Network. For more information about anxiety and depression, as well as a multitude of behavioral health services, visit ecommunity.com/behavioral health. You're listening to eHealth Radio at Community Health Network.